Have you heard about DHEA, a critical yet often overlooked hormone in your body? I'm Dr. Richard Nguenti, and what I'm about to share could transform your understanding of hormonal health. As a compounding pharmacist and expert in integrative medicine, I've seen firsthand how understanding DHEA can make a significant difference in patient outcomes. Stay tuned for vital information that even many healthcare providers may not know. Don't forget to subscribe to ensure you don't miss this essential knowledge about your health. My name is Dr. Richard Nguenti. I am a product formulation compounding pharmacist with a master's degree and PhD in integrative medicine. I am board certified in anti-aging, metabolic, and functional medicine. I have compounded more than 50,000 physician-prescribed custom hormonal prescriptions for patients under my care, which demonstrates my qualification to educate everyone, including physicians, about these important hormones in the human body. Let's examine DHEA very carefully and find out why it is a critical hormone in the human body. Dehydroepiandrosterone, DHEA, and its sulfated form, dehydroepiandrosterone sulfate, DS, are two crucial steroid hormones in the human body. Both are highly abundant, with levels typically exceeding 1 million nanograms per milliliter. Their significance is reflected in the fact that low levels of DHEA and DHEAS have been associated with a range of negative consequences that occur as we age, including reduced lifespan, cognitive decline, and decreased muscle mass. While much more research is needed to understand their precise role and impact on human health fully, it is clear that these important compounds play a pivotal role in many aspects of aging. Thus, understanding the link between DHEA and DHEAS levels and aging represents an important area of research for scientists working to develop effective interventions and treatments against age-related decline. Neurosteroids are a class of mood-altering compounds that play a crucial role in the health and functioning of the nervous system. These unique chemicals are synthesized within the brain, reflecting the body's attempt to modulate or maintain proper neural functioning. According to renowned neurochemist Dr. Étienne-Émile Beaulieu, author of The Intelligent Brain, these potent neurotransmitters fall into two categories: those that act for the nervous system, such as DHEAS, and those that act of or by it, including allopregnanolone and pregnenolone sulfate. It is now well established that neurosteroids play an essential role in promoting social behaviors and mitigating stress responses, among other functions. Dehydroepiandrosterone, or DHEA, is one of the most abundant steroids in the human body. In both its unmodified form and its sulfated variant, DHEA accounts for a significant proportion of all steroids within the body. This makes it an essential hormone for various physiological processes, from immune function and insulin sensitivity to reproductive health and cognitive abilities. While research into the health benefits of DHEA remains ongoing, it seems clear that this powerful hormone plays an essential role in maintaining our overall health and well-being. Thus, we must keep the levels of DHEA and DHEAS within healthy ranges if we wish to stay healthy and function at our best. Maintaining a well-balanced diet, rich in protein, fruits, and vegetables, can help ensure that our bodies have enough DHEA to thrive. In addition to serving as a precursor to sex steroids like testosterone, progesterone, and estrogen, DHEA also operates outside of sex-specific roles, such as regulating the immune system and assisting in energy metabolism. Moreover, while it is present in both genders, the amount of DHEAS, the sulfated form, tends to be much higher in males than females due to its relation to testosterone levels. Overall, DHEA is not only an essential part of everyday life, but also a key player when it comes to overall health and well-being. Thus, maintaining adequate levels of this critical steroid hormone should be a top priority for anyone looking to live their best life. The average concentration of DHEAS in the bloodstream is about 10,000 times higher than the most potent estrogen, estradiol. Derived from cholesterol and produced primarily by the adrenal glands, DHEA is also found in the brain, muscles, ovaries, and testes. It acts as a precursor to some of the most potent sex steroids on Earth, including estrogen, progesterone, and testosterone. This makes it essential for regulating critical aspects of sexual health and functioning. Additionally, studies have shown that maintaining healthy levels of DHEA can help ward off certain diseases and disorders, such as osteoporosis, heart disease, depression, and even Alzheimer's. Overall, it is clear that DHEA plays an essential role in our lives, both on a physiological and mental level. Whether we are seeking to boost our sexual drive or protect ourselves from some deadly disease, DHEA can help us to achieve these goals and more. As we age, our levels of DHEAS, a critical hormone that plays a role in many different physiological functions, begin to decline. Studies have shown that our DHEAS levels peak around our mid-20s and gradually decrease to around 20% by age 70. However, once these levels begin to drop, there is no feedback mechanism to restore them or slow their gradual decline. This can have negative consequences for many aspects of health and performance, including mood and cognitive function, as well as bone health and cardiovascular function. Therefore, it is crucial to take steps early on to keep our DHEAS levels healthy to preserve overall wellness as we age. This may involve changing dietary and lifestyle habits, such as increasing physical activity or getting sufficient sleep each night. Doing so can help protect ourselves against the harmful effects of declining DHEAS levels over time. As we age, our levels of DHEA and other sex hormones gradually decrease. Although this decline may not be noticeable at first, over time it can have a profound impact on the health and functioning of the brain. Studies have shown that as these sex hormones decrease, the brain becomes more vulnerable to the potentially damaging effects of cortisol, a hormone produced in response to stress. By weakening the connections between neurons in the brain, cortisol can disrupt communication between different regions and increase one's susceptibility to memory loss and dementia. In addition, as DHEA and related metabolites continue to decrease, other potentially harmful factors can take their toll on brain health. For example, chronic inflammation is known to disrupt normal neural function and contribute to cognitive decline over time. Overall, it is clear that keeping our hormone levels in good shape is crucial to keeping our brains from getting hurt as we age. Among adults, the daily production of dehydroepiandrosterone sulfate, DHEAS, declines steadily with age, while levels of the stress hormone cortisol remain relatively constant. This decline in DHEAS production results in an increased Cortisol-DHEAS ratio, which has been linked to several age-related health problems. Studies have shown that the increased Cortisol-DHEAS ratio is associated with higher levels of inflammation, impaired cognitive function, and an increased risk of mortality. Additionally, the increased Cortisol-DHEAS ratio has been linked to a decreased sense of well-being and increased odds of depression. These findings suggest that maintaining healthy levels of DHEAS may be necessary for preventing age-related health problems. This unbalanced relationship between cortisol and DHEAS can create potentially harmful conditions for the hippocampus, which is the part of the brain involved in memory and learning. When cortisol levels are too high and DHEAS levels are too low, it can lead to hippocampal atrophy and contribute to the pathology of neurodegenerative diseases. So it is essential to keep these two hormones in balance if you want to keep the hippocampus healthy and avoid diseases that damage nerve cells. Dehydroepiandrosterone, DHEA, and its sulfate ester, DHEAS, are neuroactive steroids that decline with age and have shown promise as biomarkers for Alzheimer's disease, AD. DHEA and DHEAS concentrations in late life are associated with cognitive function, brain structure, and synaptic connectivity. Low DHEAS is a risk factor for AD, dementia, and cognitive decline. DHEAS may contribute to AD development by influencing synaptic connectivity and neuronal differentiation. DHEA may play an essential role in the brain aging process by attenuating the age-related decline in cognitive function. In conclusion, decreased concentrations of DHEAS may be an essential indicator of AD. Further research is warranted to elucidate the exact nature of this relationship. The restoration of DHEA has long been recommended as a method to enhance both physical and mental health. Studies have shown that sufficient DHEA levels help the body's levels of downstream sex hormones grow, which can have a number of positive effects on both men and women. Particularly elevated sex hormone levels can help with libido enhancement, body fat reduction, and mental and emotional wellness. Adequate DHEA levels are also likely to enhance general immunological function, which can aid in the defense against a variety of diseases and infections. It is evident that DHEA replacement treatment can greatly slow down the aging process by equipping your body with the resources it needs to manage stress and maintain good health for a long time after you stop taking it. It is essential to monitor the levels of sex hormones during DHEA supplementation. While DHEA can have many benefits, too much of it can lead to its distressing symptoms. These symptoms can include changes in mood, hair loss, acne, and changes in body composition. Therefore, it is essential to work with a healthcare professional to ensure that DHEA levels are within the normal range. Additionally, it is essential to monitor DHEAS levels during supplementation as well. DHEAS is a byproduct of DHEA metabolism, and levels of DHEAS can rise if DHEA levels are too high. If you are supplementing with DHEA, be sure to talk to your doctor about the best way to monitor your hormone levels. DHEA has been shown to offer anti-inflammatory actions. Cytokines are proteins secreted by cells that help regulate the immune response. They can be either pro-inflammatory or anti-inflammatory. Pro-inflammatory cytokines like IL-1 and TNF promote inflammation, while anti-inflammatory cytokines help to reduce it. DHEA is an anti-inflammatory cytokine that inhibits inflammatory responses in macrophages by activating the protein NRF2. NRF2 is a transcription factor that regulates gene expression for inflammation-mediating molecules like IL-1 and TNF. By binding to and regulating NRF2, DHEA helps reduce the levels of these pro-inflammatory molecules. This, in turn, leads to a reduction in inflammation. Even though we don't fully understand how it works yet, it is clear that DHEA is a key part of reducing inflammation. The main difference between these two compounds lies in the presence of a sulfated group on DHEA sulfate. This group makes DHEA sulfate more soluble in water, which is why it is the predominant form of DHEA found in circulation. Approximately 98% of the circulating DHEA in the bloodstream is in the form of DHEA sulfate. DHEAS has a sulfate group attached to it, which makes it more hydrophilic and thus more likely to bind to albumin, its carrier protein. Because of this, DHEAS has a slower metabolic clearance from the circulation than DHEA. This difference in clearance rate is thought to contribute to the observed physiological differences between the two hormones. For example, DHEAS levels are more stable throughout the day than DHEA levels, which fluctuate more in response to changes in stress and activity levels. Additionally, DHEAS levels have been found to decline with age at a slower rate than DHEA levels. So, the sulfate group attached to DHEA seems to change how it is used in the body and how it works. DHEAS is a more stable marker of adrenocortical activity and stress that accumulates over time, whereas DHEA may be better at reflecting the response to acute stressors. Studies have shown that DHEA levels are typically significantly higher in healthy individuals than in those with chronic conditions or acute illnesses, suggesting that DHEA may more accurately represent a person's hormonal balance and overall state of health. This hypothesis is supported by the fact that DHEA levels tend to fluctuate more in response to short-term stressors, whereas DHEAS levels remain relatively steady despite ongoing fluctuations in one's environment or physiological status. Thus, DHEAS can serve as a valuable marker for overall long-term adrenal function, while DHEA can help provide insights into an individual's response to acute challenges. In the end, both DHEAs can give important information about how the body reacts to stress and can help doctors figure out where they need to intervene or do more research. DHEA and DHEAS are important hormones that play critical roles in the development, maintenance, and survival of the central nervous system. DHEA is involved in modulating neurotransmitter synthesis and release, influencing immunity and inflammation, regulating endothelial and cognitive function, and promoting neurogenesis and neuronal survival. DHEAS exhibits similar effects on the CNS, but acts as a precursor to DHEA, instead of functioning independently. DHEA and DHEAS are critical for normal brain function, making them essential components of any comprehensive strategy for optimizing neurological health. By controlling these fundamental processes in the brain, DHEA and DHEAS help promote overall brain health and prevent the onset of age-related neurological disorders such as dementia and Alzheimer's disease. Given how important they are for keeping our minds healthy throughout our lives, we need to keep coming up with ways to keep our DHEA and DHEAS levels at their best so that our brains stay healthy. DHEA and DHEAS are essential hormones in the body that play a role in various physiological processes, including neurotransmission. DHEA and DHEAS bind to and activate the NMDA glutamate receptor, which controls neural excitation and plasticity. Additionally, DHEA and DHEAS modulate dopamine signaling by increasing dopamine levels in the brain, thereby promoting feelings of reward and pleasure. These hormones also work to inhibit GABA activity by decreasing the responsiveness of GABA receptors, thereby influencing neuronal communication pathways in the brain. Altogether, these biochemical effects make DHEA and DHEAS critical players in neurotransmission and neural signaling that can have both positive and negative effects on cognitive function. To keep the brain healthy, it is important to know how DHEA and DHEAS affect these fundamental processes. DHEA, or dehydroepiandrosterone, has long been considered a relatively inactive hormone in the body. Despite its well-established role in hormonal signaling and metabolism, many scientists had previously assumed that DHEA did not have any specific receptor sites or mechanisms. However, recent research has shown that this is not the case. DHEA has a number of different receptors and signaling pathways that are very similar to those of other steroid hormones, such as estrogen, progesterone, testosterone, and glucocorticoids. These findings have important implications for DHEA therapy and our general understanding of steroid receptor function. Therefore, it is clear that DHEA should no longer be viewed as an inactive precursor to other hormones, but rather as an active player in its own right. Overall, DHEA is still a significant part of human health, and it will continue to be the subject of a lot of research in the future. Cell proliferation, differentiation, and death have been shown to have various effects on DHEA. DHEA directly competes with 17-estradiol for binding to estrogen receptors, ERs, thereby modulating estrogen target genes. DHEA also stimulates the proliferation of MCF7 cells, a breast cancer cell line. These findings demonstrate that DHEA interacts directly with in vitro and modulates estrogen target genes in vivo. This data suggests that DHEA may play a role in the development and progression of breast cancer. Studying the effects of DHEA on depression is one way to help understand more about this debilitating disease. One study found that people who took dehydroepiandrosterone during a double-blind treatment had a much bigger drop in their Hamilton Depression Scale scores, and 5 out of 11 patients, instead of none, saw their depressive symptoms go down by 50% or more. Studies demonstrate a significant association between DHEA and increased bone mineral density, likely due to DHEA's ability to increase osteoblast activity and insulin-like growth factor 1, IGF-1 expression. IGF-1 is also known for its ability to heal fractures, which may support the idea that it can also heal bones. DHEA and DHEAS have been shown to help women's sexual functioning. In a study of 400 postmenopausal women, persistently low levels were connected with HPA axis dysregulation, leading to lower libido among other symptoms, such as depression, body image dissatisfaction, fatigue, and insomnia, which in turn led back to feelings about sex being less vital for oneself or one's partner, because it is fraught with so many negative emotions. DHEA and DHEAS have significant effects on neurotransmission, modulating various neurotransmitter receptors involved in mood regulation, cognition, and motor control. Additionally, DHEA and DHEAS are also known to play important roles in regulating inflammation, blood pressure, stress response, insulin sensitivity, immune function, and more. Even though both hormones are known to be essential for keeping the body healthy, they are still the main focus of research into how they work inside the body. A new study has found that higher serum levels of DHEAS are associated with healthier psychological profiles, regardless of age. The study found that higher DHEAS levels were associated with better executive function, working memory, attention, concentration, and enjoyment of leisure activities. In addition, the study found that higher DHEAS levels were associated with an overall stress buffering effect. This study suggests that DHEAS may be a valuable marker for psychological health. DHEA and DHEAS are hormones that can stimulate dopamine release in the brain. Dopamine is a neurotransmitter well known for being the pleasure center of the brain. However, the pathways for raising dopamine are different for these two hormones. DHEA can raise dopamine levels by increasing the release of dopamine from neurons. DHEAS can raise dopamine levels by inhibiting the reuptake of dopamine into neurons. DHEA is more effective than DHEAS at raising dopamine levels. DHEAS is more effective than DHEA in preventing the breakdown of dopamine. Due to its effects on dopamine levels, DHEAS has been shown to have powerful antidepressant effects. This is accomplished through genomic, slow, and long-lasting mechanisms. DHEAS upregulates the levels of tyrosine hydroxylase, an enzyme responsible for dopamine production. DHEAS makes dopaminergic signaling work better by improving the structure and function of neurons in different parts of the brain. DHEAS protects neurons from damage caused by things like oxidative stress and inflammation in the environment, so they can keep making dopamine for longer. Thus, DHEAS works by targeting multiple pathways in order to upregulate dopamine production and improve neurotransmission. This allows it to provide potent relief from depression without many of the unwanted side effects commonly associated with conventional antidepressants. In short, DHEAS uses slow and long-lasting genomic mechanisms to address the neurobiological causes of depression and help people better deal with their symptoms. DHEA is a naturally occurring hormone that plays an essential role in regulating mood and energy levels. In recent years, it has also been shown to increase dopamine levels in rapid, intense, short-lived bursts. This effect is thought to be caused by how DHEA affects the brain's reward system. When dopamine levels are increased in this way, it leads to a sense of pleasure and satisfaction. In addition, DHEA has also been shown to improve memory and learning. As a result, it is thought that DHEA may be a valuable tool for treating conditions like ADHD and depression. It is no secret that inflammation is at the root of most chronic diseases. What is less known, however, is that there is a natural way to reduce inflammation and its debilitating effects. DHEA, or dehydroepiandrosterone, is a hormone produced by the adrenal glands. It has often been referred to as the mother hormone because it is a precursor to testosterone and estrogen. While DHEA levels decline with age, researchers have found that supplementing with this hormone can have powerful anti-inflammatory effects. In one study, for example, scientists found that DHEA could reduce the inflammatory response triggered by LPS, or lipopolysaccharide. LPS is a molecule found on the outer membrane of gram-negative bacteria. When exposed to LPS, cells produce large amounts of pro-inflammatory cytokines. These cytokines are responsible for many symptoms associated with inflammation, such as joint pain and fatigue. However, when cells are treated with DHEA, they produce more of an anti-inflammatory cytokine called NF-κB. This helps reduce the inflammatory response and improve overall health. More research is needed to understand precisely how DHEA works at a molecular level. These findings suggest that DHEA may be a valuable treatment for degenerative diseases. When treating a patient with low androgen levels and low DHEAS levels, it is important to consider the route of hormone administration. The most common routes are oral, sublingual, topical, and vaginal. The route of administration can affect the absorption and metabolism of the hormone, which can impact the efficacy of treatment. When administered topically, DHEA is an effective treatment for various skin conditions, including skin elasticity and atrophy. Not only does its application help to prevent skin from becoming dry or damaged, but it can also help to promote the growth of new skin cells and restore the skin's natural suppleness and firmness. Additionally, DHEA is highly effective when applied directly to the vagina or vulva as a treatment for vaginal dryness and atrophy. By improving local hormone levels, this hormone supplement helps alleviate many low androgen symptoms associated with menopause or other clinical conditions. Overall, when administered topically, DHEA offers a wide range of benefits in terms of skin health and vaginal health, making it an important treatment option for anyone looking to maintain healthy skin or manage low androgen symptoms more effectively. When it comes to topical DHEA administration, there are a few key caveats to be aware of. Unlike oral DHEA, which undergoes first-pass metabolism through the liver and is therefore subject to sulfation, topical DHEA does not undergo any type of clearance process. As a result, skin elasticity and vaginal dryness may improve with topical DHEA therapy, as the skin remains well nourished and the vagina can retain sufficient moisture. Additionally, because topical DHEA does not pass through the liver, levels of DHEAS in the bloodstream are not affected. This makes topical DHEA a good choice for women experiencing low androgen symptoms such as vaginal atrophy or weight gain that do not respond well to conventional treatments. Overall, topical DHEA can be a safe and effective way to treat low androgen symptoms if used correctly and under close supervision. Animal studies have shown that with topical DHEA treatment, the unsulfated DHEA crosses into the brain and initiates the production of DHEAS right on site. However, when it comes to using topical DHEA supplementation as a therapeutic approach, this poses a number of challenges. The practitioner must rely on monitoring the patient's progress in improving their symptoms, which can be difficult due to the subjective nature of many aspects of symptomatology. Additionally, it is not always clear exactly how much direct impact the topical application has on specific areas of the brain or body. Nevertheless, despite these drawbacks, topically DHEA appears to be an effective and promising therapeutic option for treating certain conditions related to hormonal imbalance and deficiency. With more research and tweaking, this method could help people with various conditions improve. Low androgen symptoms can be frustrating to deal with daily. You may have tried topical DHEA treatment, but found that it did not provide the relief you were looking for. If this is the case, oral dosing may be a more effective strategy. It is important to remember that topical DHEA therapy will raise serum and salivary DHEA levels, but have little effect on DHEAS levels in these body fluids. However, oral dosing of DHEA is more effective in raising DHEAS levels. If you are considering switching to oral dosing, be sure to speak with your doctor first to determine the best course of treatment for you. While there are several potential benefits of topical DHEA administration, it is beneficial for patients with known sulfatase single nucleotide polymorphisms. These individuals are unable to convert DHEAS into DHEA, the active form of DHEA, and so using the topical route provides a way for these patients to reap the full benefits of this critical hormone. Additionally, many patients find that topical administration is preferable due to its relative ease of use and convenience compared to other methods. Overall, topical DHEA can be a useful tool to help patients reach their goals and improve their overall quality of life. This is true for both health and beauty reasons. There are several factors that can impact how efficiently and effectively your body absorbs and uses DHEA, an essential hormone involved in regulating many different processes in the body. For example, one key factor is the method by which you take DHEA. If you choose to take it in sublingual form, meaning that you place it under your tongue for absorption through your mouth, the molecule immediately enters your bloodstream with minimal delay and does not need to be modified in any way by the liver or other organs in order to cross over into different tissues like the brain. However, this approach may not be ideal for all patients. For those who are particularly sensitive, even a small dose of 5 mg of DHEA taken this way may result in side effects such as agitation or other unpleasant sensations. In these cases, taking DHEA orally in pill form may provide a more gentle and gradual effect without these side effects. Ultimately, whether you choose to take DHEA sublingually or orally depends on your physiology and what outcomes you hope to achieve from taking it. Regardless of which method you choose, however, it is important to remember that proper dosing and careful monitoring are essential for getting the most benefit. DHEA, dehydroepiandrosterone, is a natural hormone produced by the adrenal glands. It is involved in the production of other hormones, including testosterone and estrogen. DHEA levels decline with age, which can lead to a variety of health problems. However, oral DHEA supplementation can help increase DHEA levels and improve symptoms. In one study, participants who took oral DHEA saw a significant increase in DHEAS levels in all commonly tested body fluids: saliva, blood spots, serum, or urine. Furthermore, they experienced a marked improvement in symptoms. These results suggest that oral DHEAS supplementation is an effective way to increase DHEA levels and improve health. When orally administered, DHEA is converted into its sulfated form, DHEAS. This process is essential for DHEA to exert its biological effects throughout the body. However, because DHEAS has a much higher polarity than DHEA, it cannot cross the blood-brain barrier. In contrast, DHEA is nonpolar and can quickly diffuse through the membrane that surrounds the brain. So, taking DHEA by mouth might help the liver and muscles, but it will not change how the brain works or how people act. A growing body of research suggests that oral DHEA administration leads to the production of biologically active DHEAS. This is due to what is known as first-pass metabolism, in which ingested DHEA is metabolized by the body before being released, increasing the circulating levels of this hormone. This has important implications for our understanding of how the body regulates its levels of DHEA and the role that DHEAS may play in this process. While much research still needs to be done in this area, it seems likely that DHEAS can be viewed as part of our natural reservoir of this hormone, ready and able to convert to DHEA on demand when needed by the body. In the end, these results may open up new ways to use oral DHEA supplements to improve health and well-being. When it comes to taking DHEA, how you administer the supplement can significantly impact how much of it is absorbed and how quickly. For example, troch or sublingual DHEA goes directly into the bloodstream and is measured in serum levels. Unlike oral forms of DHEA, which are sulfated, this form crosses directly into the brain and other tissues. This makes it particularly effective in targeting specific areas of the body that need attention, such as neurological conditions like depression or cognitive decline, or hormonal imbalances caused by menopause or adrenal fatigue. Overall, when it comes to effectively tapping into the many benefits of DHEA supplementation, the delivery method is just as important as the dosage itself. For some patients, even small amounts of DHEA can cause side effects, such as agitation and anxiety. In these cases, it may be preferable to take DHEA orally, rather than using a sublingual formulation. Regardless of whether DHEA is taken sublingually or orally, it is essential to consult with a medical professional before beginning treatment to determine an appropriate dose and potential side effects. With suitable precautions, DHEA can be a good treatment for some health problems. It can help improve sleep, brain function, and overall health. Rheumatologists have known for a long time that inflammatory diseases like Crohn's disease and multiple sclerosis are linked to low levels of dehydroepiandrosterone sulfate. According to recent studies, this correlation may also apply to other autoimmune diseases. Lower serum concentrations were found to be predictive of developing and imminent clinical symptoms among patients already diagnosed with hypothyroidism, according to a study conducted in Japan. Lower DHEs predicts the clinical characteristics of impending RA in persons with primary hypothyroidism. Similar mechanisms may be at play in the low levels of DHEAS observed in numerous rheumatological diseases. It is also possible that a lack of DHEAS, together with exposure to cytokines, leads to a hitherto undetected pre-rheumatoid arthritis-like condition. Future studies on primary hypothyroidism should focus on the role of reduced DHEAS levels in producing sensations of weariness and joint aches. A study has suggested that higher serum levels of DHEA are associated with a decreased risk of developing type 2 diabetes. This is important because it may play an integral part in preventing the disease before it develops, which could have significant implications for how we prevent and treat patients with type 2 diabetes. 43. DHEA may help reduce abdominal fat and improve insulin resistance. One study suggests it also helps with inflammation in the arteries, which could also lead to reduced arterial stiffness. People with lupus may benefit from these effects because abdominal fat, insulin resistance, and arterial stiffness are all linked to a higher risk of lupus flares, and arterial stiffness is a predictor of heart disease in people with lupus. The human body is constantly breaking down and rebuilding. This process is essential for maintaining strong, healthy bones. DHEA has been shown to boost osteoblast activity, and insulin-like growth factor IGF-1 expression, both of which contribute to greater bone mineral density, as shown by a number of studies. DHEA is a powerful activator of IGF-1, and IGF-1 is known to promote fracture healing as a result. This is one of the main reasons older adults are at greater risk for osteoporosis. However, studies have shown that supplementation with DHEA can help improve bone density because supplementation helps restore depleted DHEA stores as we age. Such a decline has been linked to reduced osteoblast activity and IGF-1 expression. Supplementation with DHEA has been shown to increase osteoblast activity and IGF-1 expression, leading to increased bone density. In addition, DHEA has also been shown to reduce the rate of bone loss. This makes it an essential supplement for anyone interested in maintaining healthy bones as they age.